We're delighted to be partnering with the Child Accident Prevention Trust, or CAPT for short, for Child Safety Week 2021. This is an annual event run by CAPT, and this is the third year of our partnership, supporting the campaign and having a dedicated day during the week to focus on raising awareness of the risks that lead to children being burned. This year's theme is Share Because You Care, highlighting how sharing safety knowledge really does help save lives. And these figures underline just how important it is for us to share with you today. The figures provided by the National Burn Injury Database show that in 2020, 8,013 children in England and Wales were burned or scalded so badly that they had to be admitted to a specialist burn service. Nearly 6,000 of those children were under 5, and this does not include the thousands seen by A&E departments. It's estimated that every half an hour, a child is burnt. The majority of these burns occurred in the kitchen or living room, and that top activities were play and exploration, and then food preparation. Accidents happen in the blink of an eye, but if we can be more aware of the dangers and of the right first aid, we can hopefully reduce the numbers and severity of these dreadful injuries. Before I hand over to the presenters for the formal part of the webinar, I would just mention that there will be ample time for questions after their presentations. If I could ask you please to type any questions you have into the chat box as we go along, and then our speakers Vicky Dudman and Chrissy Stiles will then be joined by Nadim Khwaja, Consultant Burns and Plastic Surgeon, and CAPT CEO Katrina Phillips, and we'll put your questions to them. So without further ado, I'd like to hand over to our first speaker, Vicky Dudman, Specialist Occupational Therapist and current Chair of the British Burn Association's Prevention Committee.
Thank you, Alison. I'm just going to share my screen. And if I can just ask Alison to confirm that you can see it changing for me.
Yes, I can see it changing, Vicky.
Brilliant. Thank you very much. Good afternoon, everybody. I think you will agree that some of those statistics are shocking. There are many risks within the home that can lead to a burn injury. I would like to highlight some of those risks and suggest some ways to minimise them. Young children develop rapidly and learn new skills all the time, but they have little or no sense of danger. Many serious burns happen when children take their parents or carers by surprise and reach new milestones. All too often, parents are caught out as they didn't know their baby could reach out or grab or wriggle so much, or that their child could reach the tops of tables or cookers or climb into the bath. That's why it's so important to help parents understand the links between child development and the accidents that children suffer. It's also important to remember that each child is unique and will reach their developmental milestones in their own time. If parents are aware of the risks in the next stage of development, they are more likely to predict and preempt problems. There is lots of information about developmental stages of children on both the Child Accident Prevention Trust and the Children's Burns Trust websites. Let's look at some scenarios. In the kitchen, the oven and hob pose a significant risk. Small children may reach up to saucepans hanging over the edge of the worktop or could touch the hob or oven door themselves. Hot plates and ovens stay hot for some time after being turned off, and so the dangers do not disappear immediately. Toddlers love to copy adults, so they may try to stir pans on the hob or to switch on ovens or equipment. Although they can start to learn not to touch things, they don't really understand hot and cold. They may not even pull their hand away when they touch something hot. This will increase the contact time and worsen the effect of the burn. It is much safer to use the rear hot plates and turn handles away from the surface edge. Or ideally keep children out of the kitchen when you're cooking and never leave them unattended in a kitchen while appliances are turned on. A devastating injury I have treated happened when a parent was picking up a saucepan to take it to the sink to drain. As they turned around, their toddler appeared beside their legs and the pan of hot water spilled over the child. Other dangers in the kitchen include kettles with dangling leads, which can be grabbed and pulled. Keep kettles towards the back of the worktop and leads tucked away. It's also important to think about the ways your child could start to climb up onto worktops, either on chairs, drawers, or bins. They can be very resourceful. The most frequent accident in the living room, or in fact many environments, including coffee shops and restaurants, are hot drink spills. Hot drinks that are left on any surface could be reached or not, particularly if there's a tablecloth that could be pulled. Often this happens when babies are just beginning to stand and furniture walk. They can reach things that they were not able to just a few days or weeks before. At this stage of development, older babies are naturally inquisitive and will explore their environment as much as they are able. Because their skin is so delicate, a mug of tea or coffee with milk left standing for 10 minutes can still scald a baby or toddler in less than 1.5 seconds. The typical distribution of a burn for this type of accident can cover a child's face, neck, chest, and arms, as you can see in the diagram in the middle. Clothing can also spread the liquid from a hot drink over a larger area. I've seen scald injuries that have occurred in coffee shops when people are using disposable coffee cups, where the lid is not fitted properly. These cups can be squeezed and the hot liquid spills out very easily. Also be sure not to pass hot items over the top of babies and toddlers sitting in pushchairs. When carrying or holding hot drinks, it's very easy for a child wriggling in your arms or crawling or toddling on the floor to knock you off balance and to cause a spill. And of course, drinks left on the floor would be at risk of being knocked over too. Always be aware when there are hot drinks and young children in the same area. Keep hot drinks away from young children and never hold a child while you are drinking or carrying a hot drink. Burns classified as contact burns include those that are sustained from direct skin contact to a hot object. These can occur in many rooms within the home. Radiators, pipes, and heated towel rails can get very hot. You can cover any low-level pipes with insulating material. The outside of a log burner also becomes incredibly hot and should be protected by a fire guard in the same way that an open fire needs a guard to stop children getting too close. Irons and hair straighteners reach very high temperatures and can cause deep burns. Once turned off, sorry, can someone just mute themselves? Sorry, do that bit again. Once turned off, they can take a long time to cool down. I have seen many injuries, particularly to children's hands, where they have touched a hot iron or hair straightener, or to the soles of their feet where they have trodden on a straightener left on the floor. The skin of arms and of hands and soles of feet are highly likely to develop complications like skin contractures when they heal. This can mean that the skin tightens and in many cases can prevent the child from being able to fully open their hand. This will require further surgery as they grow and develop over many years, as well as the use of splints and other therapeutic treatments between surgeries. Don't leave hot irons and hair straighteners within a child's reach while they are cooling. Use heat-proof bags for hair straighteners, and remember that loose leads can be a temptation for children to pull. I don't think my screen is moving. I'm just going to stop sharing and go back in because that seems to have frozen. Apologies for that. Even a simple activity like running a bath can be very dangerous. Children's fragile skin can burn at much lower temperatures than an adult's. Ideally, run cool water before hot, and do not leave a child unattended while the bath is running or while they are in the bath. Test the temperature before putting the child into the water. The best way to do this is with your elbow. You can also get thermostatic mixing valves to limit the maximum temperature of the bath water. Small children love to help, so they may try to turn on hot taps. Older children also like to help bathe their younger siblings, but may not be fully aware of the risks or the delicate skin their younger siblings have. I have seen 2 life-changing incidents involving children helping to bathe their younger siblings, but being unable to rectify the problem when it became clear that something was wrong. In both cases, the younger child sustained deep burns to their legs, feet, buttocks and hands, and have needed to undergo years of surgical treatment and therapy. Added to the impacts of the physical effects of the burn injury, there is also the psychological trauma for the whole family, especially those siblings who are only trying to help. Other items to keep out of reach of children include matches, cigarette lighters, and candles. Toddlers and young children can find these items fascinating, so ideally keep them out of sight and out of their reach. Remember that although lighters are child resistant, many 3 to 4-year-olds will be able to operate them in a few seconds, and that the child resistant mechanism is no barrier for older children. Another type of burn that can be incredibly damaging is chemical burns. Everyday cleaning products can cause significant chemical burns, and children can be at risk of either getting chemicals on their skin or swallowing the products. Depending on the strength and type of chemical, the intensity of the burn can vary. However, they are nearly always significant enough to require surgical intervention. There are, of course, other hazards that I've not mentioned. Please feel free to ask about the further risks in the Q&A or by the chat function. Remember that this advice can be extended to other environments, as the risks do not disappear if you are visiting family and friends, or on holiday or out and about. Awareness of the potential risks and making a few simple changes can greatly reduce the chance of a painful and life-changing accident. Thank you for listening.
So much, Vicky. That was really, really eye-opening, actually. As I mentioned earlier, our panel will be answering all questions at the end of the presentation, so please do keep on typing them into the chat box. And any questions that we don't have time to address today, we'll put together a Q&A sheet to circulate after the event. Next, however, I would like to introduce our clinical nurse specialist and author of the Family Oops Burns First Aid book, Chrissy Stiles.
Alison, thank you very much. I'm just going to share my screen with you all. Can you please confirm that you can see it? Brilliant, thank you very much. As Alison said, my name is Chrissy, and I'm the author of the Family Oops and the Burns First Aid book, which was written with the belief that we can really invest into our next generation of burns first aiders through reading and education at a very young age. So today we're here to educate the adults who belong to those little people, so that we all know the right thing to do should a burn injury happen in our home. So it is rare to have a burn injury. However, as Alison and Vicky both already alluded, burn injuries tend to happen in our safest places, in our homes. So in order to be prepared, I'd like to just let you know what is likely to happen in those few initial moments when a burn injury does occur. Vicky already said that children's skin is very different, and it's different because it's much thinner than an adult's. It means in real terms that a drink that you or I could be holding that spills over us will create some pain, a little bit of redness on our skin, but it's very rare that it would cause a significant injury that requires attendance to a burn service. In case of children, their skin is so much thinner, it's not grown its thickness yet. And the same drink could harm them much more severely, causing blistering, causing deeper burns, potentially leading to something that leads to an operation and a scar. And burns are painful injuries. We all know that, from touching an oven door or staying out in the sun for too long. They hurt. So if something like this happens at home, please don't hesitate to give your child some proper pain relief, something that you would normally give them for a fever or a sprain. Please make sure that they have some pain relief on board, because burns do really hurt. And skin's natural reaction to being burnt is initially reddening, and then it tends to bubble. So blisters form, and blisters are pockets of skin that fill with liquid. And sometimes they will pop, sometimes they stay as they are. Quite often we find that interventions such as initial first aid or removing of clothes might make those blisters pop and rip. And it can be quite traumatic for parents who think that they're harming their child. But actually, it's a natural process of the burn injury that just tends to happen. And there's nothing bad if that does happen in front of your eyes. No doubt the healthcare professionals who attend to your child later will be able to manage those wounds that have been created by the burn injury. But blistering, ripping of blisters is actually a normal process, part and parcel of the burn injury. Of course, burns can be very serious, which is why we're here to let you know at the far end, where we manage the children in the long term, what can happen. And yes, a burn can lead to an operation. Operation means creating another wound, skin transplant operation. We're trying to heal the wound that's injured, taking it from an area that hasn't been injured and is lovely and intact. And of course, once the burn injuries have healed, that can result in a scar. And as Vicky was saying, sometimes scars can lead to difficulty moving, stretching, just getting on with daily activities. So it can be a long-term and lifelong concern to have a burn injury at an early age. It will always be an emotional time in the household when somebody you know and love and care for gets a burn injury. It's not only painful, the child will be distressed and crying, and the parent, you as a parent, will be distressed and crying too. So you can imagine, as we're trying to involve ourselves in that moment and to tell you, you need to try to keep your head on and do the right thing, it can be really difficult. So just accept that it is going to be a traumatic, stressful experience, and you will all be crying, and that's okay. Call for help and get help on the way, and we will tell you what the right thing to do is in that moment. Because of course, the best chance your child has got at getting over this injury quickly, at having minimal scarring and possibly not even needing surgery is you. You are there first. You are the best first aider that that child can possibly hope for. You are there first. You can do the right thing. And we're here to tell you what that is. So the first step is not to put on anything that you find in your kitchen cupboards. We see a lot of wrongful first aid being applied, and quite often this is something that we adopt as children, and we grow up around other adults in our lives who've applied burns treatments historically or even culturally. So we see quite a bit of application of, for example, toothpaste. Toothpaste on a burn wound will just coat the burn in the toothpaste material, and actually makes it very difficult for us as specialists to assess and look at the burn. So toothpaste doesn't work. I know it's minty fresh and cooling when you put it in your mouth, but unfortunately does not belong on the burn wound. Egg whites quite often get applied, and again, it's not sufficient first aid. It doesn't do nothing, it doesn't do anything for the healing of the burn wound or improving its outcome. Butter gets frequently applied, creams get frequently applied, and again, if you're putting anything greasy that coats the burn, it actually stops the heat from escaping. And in that first moment, what we actually want is for the heat to escape as fast as possible, so it stops doing the damage in the baby's skin. Of course, the worst thing that we can do is to put on anything really, really cold on the burn. So things like ice or bags of frozen peas or frozen sweet corn that come out of the freezer is a really bad idea. And it's a bad idea because ice and cold things will react with your blood vessels. So the baby's blood vessels will shrink to non-existent, and that essential blood flow that will carry oxygen, nutrients, all the things that the wound will need to heal, unfortunately, we've stopped that process because we've put on something incredibly cold that's shrunk our blood vessels. So none of these products belong on a burn injury. The initial step you have to do is that anywhere near the burn wound, you remove anything that's going on top of it or sits really close to it. This means baby grows, nappies, any clothing, any jewelry that's right next to the burn wound needs to come off. We'll remove clothing because, similar to the creams, it will keep the heat in and will reduce the impact of your first aid intervention. So everything that you will be doing to cool the burn won't be as effective because the clothing is still on baby's burnt skin. So take it off, bearing in mind that if the skin has started to blister, as you remove, some of the blistered skin will be lifting, will be coming away. And like we said, that can happen and it's okay. Nappies, obviously the whole purpose of the nappy is to keep the heat in, therefore remove the nappy, remove the liquid that possibly was scalding hot away from baby's skin. So we take those off. Jewelry, rings, bracelets, necklaces can stop the swelling from developing, and all wounds that are injured will want to swell up. And if you remove the rings, there isn't going to be any problem with blood flow in and out of that wound. And cooling is the best first aid. So we talked about things not to put on a burn. Now we're going to say about this is what you have to do as a parent, as a carer, as a grandparent, as somebody who looks after a child. This is the best chance they've got, is you to do cooling. Running tap or shower water is perfectly fine. You don't want to do cold water. You want to do lukewarm, tepid, or as warm as the child will tolerate, because we don't want to make them cold. So cool running water, as warm as they will tolerate, is still going to be effective first aid. And we do this for 20 minutes. Yes, not 1 minute, not 20 seconds that we're normally used to when we burn ourselves on the tap somewhere, but actually it is 20 minutes, and it will seem like a lifetime. I won't lie to you. With a crying child that's clinging to you, with you crying, it's going to seem like a lot of time has passed, but 20 minutes is the effective window to reduce that depth, to reduce the size of injury. That will mean less scarring, less need for surgery. This is the best thing that you can do. And this process is still effective within 3 hours of the burn injury. So say you're not able to do it immediately, or you were a little bit unsettled for the first few minutes, it's fine. You've got 3 hours, but the sooner, the better. What if you're not anywhere near a shower or running tap water? Well, you can use a wet, clean cloth or a towel. That's perfectly good. Something that's non-fluffy, something that's not going to shed fibers. Put that on nice and cold, so wet it under the bottle of water over it, put it onto the child's burn, but keep it changing every 5 minutes or so, because similar to clothing, that cloth will warm up and will keep the heat in. So we need to reapply water, put it back on the child. Again, doing 20 minutes in total, still effective within 3 hours of injury. And after you've done the cooling, we need to just make sure that we're actually keeping the rest of the child warm. Wrap them up and cool just the burn. We don't need to douse the whole child in cold water, because all of them is unlikely to have been injured. So burn area only, keep the child warm. Remember the 3 hours. Don't let the 3 hours lapse without doing first aid. And then reach for cling film in your cupboard. Only put cling film on after you've completed your cooling. So cling film on in very loose strips. It is not a dressing. It is something that just will take out the sting out of the burn. So if the wound is open to air, it's going to be stinging and hurting. As soon as you cover it with cling film, that pain will die down and the child will start to settle. So put it on, never wrap all the way around, because that gets very tight. Cling film, as you will know, is not a stretchy material. Or you can leave a clean, non-fluffy cloth on. and keep the rest of the child warm. Once you've covered them up, then it's time for you to call for the medical advice. So if you think that your GP can help locally, 111 is a really good resource, or in an emergency, absolutely dial 999 and get the paramedics to urgently attend to your child. But whilst you're waiting, remember those 20 minutes calling. You're still doing this throughout this process. Timing is everything when it comes to burn injuries. And I'm about to tell you a story of two boys, one who's had first aid and one who didn't. And I want to explain, before I show you those images, that why it is so important and why the time of injury and time after injury matters. So we talked about 20 minutes cooling with tepid, as warm as they tolerate water. We can delay this up to 3 hours. We know it's still effective within 3 hours of the burn. But what happens after we either have or haven't done the first aid is that the burn injury changes over the next 3 days. It moves on. The burn wound is a dynamic wound, and it's the reason why a lot of us in the burn services will assess the child's wound on day 3 to see whether it can heal just with dressings and no surgery, or whether it will need an operation. So day 3 is a definitive point where the burn wound has decided, this is what I'm gonna be. And then we expect the wound to heal within 3 weeks. So we wait up to 3 weeks window. That's the cutoff point, after which it's more likely that the wound will heal to a scar. Now, before I show you the stories of the two boys, I want to let you know that you will be seeing images of burnt children, of their wounds, and on the young babies' bodies. So if you do find it distressing, please feel free to turn away from the screen and just listen to my voice. So the first story is Matthew. This is Matthew. He was a very young toddler when he had a black coffee spill accident at home. He unfortunately did not have first aid at home, and 3 hours had lapsed before it was basically too late to deliver first aid. So by the time he got to the burn service, the three hours have already passed. So this is what you see on day 1 when the patient first presents to you, quite extensive injury of his shoulder and his chest. We then wait until day 3. And something that was a pink wound that has every ability to heal has now progressed and has got deeper. So it's gone white. White is a bad color in the wound. We don't like seeing white. It means that a lot of the cells have started to die, and it's actually potentially might need an operation. So this is 3 days later. At 2 weeks, we're now 1 week away from that point of no return where the burn will heal with a scar. And unfortunately, that area over Matthew's shoulder is not healing. So he had a skin graft operation, which is what you can see here, pretty much healed, and it's looking dry and crusty, and very soon is not gonna need dressing. But unfortunately, we lapsed that 3-week window. It means that at 2 months later, Matthew is healed, but with a scar. And what we often don't know about burn scarring is that this is the point where burn scars start to grow. They start to thicken, they start to rise up. It means that in a couple of months after that, Matthew's scar is very red, very risen, and much thicker in its appearance. We would be measuring Matthew for a tight bodysuit called a pressure garment, which will compress that scar flat because we don't want it to keep rising up. And the parents will be given homework to try and do scar massage and a moisturization of the scar with some creams 4 times a day. Imagine of your own working day, where can you find time 4 times a day to do this for your child? And obviously the more extensive the burn injury is, the more implications for your time doing it. Now, after wearing pressure garments, which you wear for 24 hours a day, up to 2 years after burn injury has healed, you can see in Matthew's case, the scars are flatter, they're not so red. And the disappearance of the red means that actually they're less itchy, they're slightly more comfortable, and because they've gone flatter and the massage has been done, it's less likely to be constrictive to movement. 18 months later, you can still see scarring. It is flattening. 4 years later, we're talking about long-term effects, 5 years later, and 6 years later. And Matthew is now growing up, he's growing chest hair, and actually the burn injury is no longer affecting him. It's an injury that he will not remember much of, but will stay in the memory of his parents for life. This is Henry. Henry's mum was making a cup of tea in her kitchen, turned away to get milk, and Henry ran across, just like Vicky said, looked up at the cup standing at the surface, pulled it over his face and his chest. And you can see that blistering already starting to develop over his face. Mum did the right thing. She called 999, and while she was waiting, she put Henry into a bath full of water. She said, I nearly drowned my baby in the bath full of water. And it was really the stuff that nightmares are made of, in her own words, watching her baby's skin bubbling in front of her eyes. But she did the right thing. Paramedics arrived, they continued doing cooling. In fact, they did 30 minutes in total and brought him to the hospital when he was referred to the burn service. Because first aid was done, on day 3, when we're assessing his wounds, we're seeing a dry, healing, crusty wound. It's exactly where Matthew was on day 28. That's the difference. 8 days later, healing nicely. 12 days later, and final visit to outpatient clinic within 3 weeks, fully healed, no pressure garments, no therapy, no scar massage, no follow-up is required. A year on, Henry's a lovely boy and boy, unaffected by his injury, and that's the only visible scar. It just goes to show that you're the best chance that your child has got. You are there first. 20 minutes within 3 hours is essential first aid. Please do this, because what we do or choose not to do or are unable to do can be responsible for the scars that our children wear for the rest of their lives. What you do really makes a difference. We all just have to make a decision what kind of difference we want to make. Thank you very much.
Thank you so much. Thank you, Chrissy. That's amazing. And I do feel that there's 2 other people I need to be thanking, and that's Matthew and Henry, because those examples you showed us were just stunning. So thank you. We have had a few comments in the chat and questions in the chat about what resources will be available following the webinar. And I just wanted to confirm that we will have a recording of the webinar available to view on YouTube, and we'll share links for that to everybody who's registered for today and on our social media stations. And we will also, at the end of this webinar, we'll have a slide with all the contact details for CAPT and CBT social media and websites. So now I would invite Chrissy and Vicky to join Katrina and Nadeem to answer your questions. But before that, can I ask them to switch their cameras on, but everybody else, remind you to keep your camera switched off and your microphone on mute. And we'll go to the first question. Can I just ask all of you, really, when would we call 999? What size of a burn would we call 999 or go to hospital? Don't know if maybe Nadeem wants to jump in here.
Thanks, Alison. So that's an easy question to start off with. Not, it's a very good question. It's a really important one, I think. It's actually a little bit tricky. That I suppose the first thing I'd have to say is, if in doubt, call them. You know, don't want anyone, because the advice can get a little bit variable here. I don't want anyone to not call 999 because they're worried about whether it's the right thing to do. So if in doubt, I think everyone's aware that 999 services are for emergencies and life-threatening injuries. So it's just using a little bit of common sense, but bearing in mind, and Chrissy and Vicky have given really nice examples of how stressful it is when you've got your child or someone else's child crying in front of you. So, you know, take a few deep breaths, have a look at what's going on, but if in doubt, do call them, and they will talk you through if it's serious or not and what it is. So, you know, I think that's the sort of answer I'll give. I don't know if my colleagues have got any different thoughts on that one. Looks like probably not.
we did have a question about how do you protect a child from a radiator? I know that's not necessarily for a burn care professional to answer. Maybe Katrina, or if you do have ideas, please jump in.
I did see that question come up, and I must admit I had avoided putting it in the presentation just because it's quite a difficult thing to do. Obviously, you can buy guards and things for your radiators, but they do affect the efficiency, so it will affect the cost of you running your heating and everything. With different radiators, you can adjust the temperature as well, so even if you can turn it down a little bit, that will reduce the risks. So it is a difficult area. There's no clear, simple solution, I don't think.
And I'd just add to that it's thinking about, say, where your baby's cot is, because we know of injuries that have happened when a cot is up against quite near a radiator. The baby starts moving more than they had done, and perhaps their arm or their leg is against the radiator. So I think it's also thinking about where some of the sort of furniture is in your home to minimise that risk for baby's delicate skin.
And if I could just add to that, I don't want to upset anyone by getting things a little bit more serious, but it really follows on from Katrina's point there. Bearing in mind, it's very difficult it depends on where you live as to how big or small it is, and it's very individual, and number of children you have. But to make sure that where your sofa is, and as Katrina, where the bed is and where the cot is, because the other thing we see from time to time is children becoming wedged, and then they become stuck. And of course, that's where a smaller burn becomes actually quite a lot more serious. So it's just the main thing for today is really getting this awareness, but the practicalities can be very variable depending on your individual situation. Thanks.
Thanks, Nadine. I just see we've got a new question in. What if small patches of clothing are stuck to the burn and removing them would mean ripping off skin? Would you still remove them, or can you just soak the water through the material?
I will answer that, Alison, that's fine. So yes, sometimes it can happen, and actually it is more likely to happen when you've got a flame-related injury. So if your clothing was on fire, you followed the stop, drop and roll principles, and some of the clothing is melted and maybe is very stuck onto the skin. So normally our advice is, if possible, you remove what will come away naturally and actually cut. So be quite brutal, just cut the clothing, leave the bits that are stuck on. With scald injuries, it's very unlikely to be stuck on. And actually, as you remove it, that skin that I'm talking about, the blistered skin that comes away, if you can imagine, it's quite crude, but it is a little bit like wet toilet paper. That is the thickness of it. That's how loose it is. So actually, nothing is likely to be stuck unless the child has sat in that clothing for a much prolonged period of time. So don't be afraid that the skin will lift. I understand if you're not comfortable removing, but just know that possibly the next step, the next healthcare professional that sees your child will do that, and the skin will come off just because it is damaged and it no longer belongs on that wound. Leaving that skin there is certainly of no benefit to healing.
Thanks, Chrissy. You may see that there's a new question just popped up. After a facial burn and when the area has healed and before bath time, how can we reintroduce to the kid that water is not something bad for them? Have you come across this? I guess this.
Shall I take this one?
Yeah.
Definitely, it's very common. I must admit, children remember those traumatic experiences, both from how the burn happened and also from coming to appointments at the hospital. Often just walking in the door, they're reminded of those traumatic experiences. It's very difficult. So it's doing things in stages, trying to make it fun, using lots of toys, starting off just maybe with a bowl of water and then playing around. Also access the psychotherapy services at any burn service that you're linked to, because they have lots of tools and ways to overcome these problems. Or if you didn't go to a burn service, maybe through your GP as well.
Thank you. Thanks so much, Vicky. I think we've probably covered the majority of the questions. Any more, we'll go through the chat afterwards and we'll look carefully and, as I say, put together our Q&A sheet. I did just have one more question, I'm sorry. One more question for Katrina. We've seen, I just wonder, why is it, Katrina, that the majority of these burns to children are happening in the home?
I think it's where young children are spending most time. We think it's dangerous out there and that our homes are the safest place for our child. So perhaps we let our guard down. We think we know our children and what they'll do next, when in fact, babies and toddlers are designed to take us by surprise. And I think we don't understand just how thin and delicate their skin is, or that they don't actually have, there's no automatic reflex to pull away from something that's burning you. It's something that we learn and that babies and toddlers don't have. So we don't appreciate the risk posed by our mugs of tea or our straighteners. We don't look around us and appreciate that those things can be really dangerous for young children.
Thanks so much, Katrina. Thank you. I think we are getting asked where, what's this? Please, can you advise on what the best approach is to teach toddlers and preschoolers that particular items are dangerous and not to be touched?
I think there are quite a few resources, actually. Katrina will say it's not just on the Children's Accident Prevention Trust are resources exactly for this, and different age group will have their own challenges. And also a lot of the fire services, the fire services will do a lot of this work too, and especially with young adults who are more experimental with flame and aerosols, and a completely different ball game again, but can lead to a burn. So there are multiple resources, and perhaps at the end of this webinar we could make some of these links available to you all.
I'll just add to that, to Chrissy, 100% right about the older ones need to be starting taught. For the very younger ones, it's really probably our responsibility as the adults not to leave things in front of them, particularly the cups of tea and coffee. But yes, as they get older, then of course they need to learn and understand. So it's a transition, I think. Thanks.
Thank you, Nadeem, and thank you to everybody on the panel and everybody who has attended today. I'm very, very aware that time is precious, and we've really appreciated you attending. I'd just like to pass over to Katrina Phillips now from Child Accident Prevention Trust to round up our webinar. Thanks.
Thank you. Well, I'd like to start with a huge thank you to the Children's Burns Trust for organising this event during Child Safety Week and sharing your knowledge and expertise to help prevent disfiguring burns to children. We really do appreciate your support. Burns are a particular concern for us here at the Child Accident Prevention Trust. As you've heard, every 30 minutes a child is burnt. Under 5s and especially under 3s are overrepresented in serious burns. And there are close links to child development. Babies and young children are curious. They like to reach out for things around them, but if they grab for a hot drink or hair straighteners, they can suffer a serious burn. And we also know that children living in disadvantaged areas are at greater risk of experiencing burns. As you've heard from Chrissy, good first aid is absolutely essential in terms of reducing scarring. I'd really encourage you to remember the cooling and covering tips that she shared with us, and that magic window of time, the 3 hours. But for us at the Child Accident Prevention Trust, our ideal is to stop these injuries happening in the first place, and that's where all of you come in. The theme for this year's Child Safety Week is Share Because You Care. And I'd like to ask everyone who's joined us today to think about all the different ways you can share what you've just learned. It could be conversations with friends, family, colleagues, or parents you work with. Share posts on social media. Follow CBT and CAPT. Look out for our new Burns animation, which we'll be posting later this month. Share our Burns fact sheet. It's available in English and translated into 5 community languages. Or run a short virtual workshop using our session plans on hot drinks and hot pans. Just go to the Child Safety Week area of our website for your free downloads. So I was gifted a mug, and it says, "Knowledge has no value unless you use it and share it." So I'd like to thank you all for your time today and encourage you to go out and start sharing. Thank you.
Thank you so much, Katrina. And here are the links that I mentioned earlier.